Welcome to Dr. Balga's podcast for the Curious Doc. Today is March 8, 2026. This video is on a Lancet Seminar on atrial fibrillation, released this week. What is atrial fibrillation? It is a common cardiac arrhythmia characterized by an irregular pulse where the rhythm is irregular and the volume of the pulse is irregular, and there is absence of organized atrial activity. How common is atrial fibrillation globally? Approximately 37.6 million people worldwide have atrial fibrillation, and prevalence is projected to double over the next decade. Why is atrial fibrillation clinically important? It increases the risk of stroke, systemic thromboembolism, heart failure, cognitive impairment, and mortality. How does atrial fibrillation affect quality of life? Symptoms such as palpitations, shortness of breath, fatigue, and reduced exercise tolerance significantly impair quality of life. What factors drive the growing burden of atrial fibrillation? Population aging, increasing cardiovascular risk factors, and improved detection through wearable technologies contributing to rising prevalence. What symptoms suggest atrial fibrillation? Palpitations, shortness of breath, fatigue, dizziness, chest discomfort, or syncope can occur, though some patients remain asymptomatic. How is atrial fibrillation diagnosed? Diagnosis requires confirmation by a 12-lead EKG demonstrating irregular RR intervals and absence of distinct P waves. Why can paroxysmal atrial fibrillation be difficult to detect? Episodes may terminate spontaneously within 48 hours and may not appear during a single ECG recording. What monitoring tools help to detect intermittent atrial fibrillation? Ambulatory EKG monitoring, event recorders, patch monitors, and handheld single-lead ECG devices can capture intermittent episodes. Can wearable devices detect atrial fibrillation? Consumer wearable devices with rhythm detection algorithms increasingly identify possible atrial fibrillation episodes in the community. Who should be screened for atrial fibrillation? Guidelines recommend opportunistic screening during health visits in individuals aged 65 years or older. What is prolonged atrial fibrillation screening? Continuous or repeated rhythm monitoring for 72 hours or longer to improve detection of intermittent atrial fibrillation. Does screening reduce stroke risk? Evidence is evolving. Prolonged screening detects more atrial fibrillation, but its effect on stroke reduction remains under investigation. What are atrial high rate episodes? Device detected atrial tachyarrhythmias recorded by implanted cardiac devices in patients without previously documented atrial fibrillation. What is subclinical atrial fibrillation? Atrial fibrillation detected by implantable or wearable devices without typical symptoms or prior EKG or ECG documentation. Why is stroke prevention central in atrial fibrillation management? Atrial fibrillation increases thromboembolic risk due to blood stasis and atrial remodeling, particularly in the left atrial appendage. How is the stroke risk estimated? Clinical scoring systems such as DS2 VAS score or CHADS2 DS2 VA stratify patients according to thromboembolic risk factors. Which therapy prevents stroke and atrial fibrillation? Oral anticoagulation significantly reduces stroke and systemic embolism in patients at moderate or high risk. Why are DOACs or direct oral anticoagulants preferred? They reduce stroke, they reduce mortality and intracranial hemorrhage compared with warfarin in most patients. When is warfarin still recommended? Patients with mechanical heart valves or moderate to severe mitral stenosis should receive vitamin K antagonist therapy. What is the role of aspirin in atrial fibrillation stroke prevention? Aspirin does not significantly reduce stroke risk and is not recommended as sole therapy for stroke prevention. How should bleeding risk be evaluated? Structured tools such as the Hasblat score identify modifiable bleeding risk factors and guide monitoring. Should high bleeding risk prevent anticoagulation? No. High bleeding risk should prompt risk factor modification and closer follow-up rather than withholding therapy. While alternatives exist if anticoagulation is contraindicated, left atrial appendage closure may reduce stroke risk in selected patients unable to take long-term anticoagulation. These are devices such as the Watchman device. Does rhythm control influence stroke risk? Early rhythm control strategies may reduce cardiovascular events and stroke when implemented soon after diagnosis. What is rate control in atrial fibrillation? Rate control accepts atrial fibrillation while regulating ventricular response using medications such as beta blockers or calcium channel blockers. What is rhythm control therapy? Rhythm control attempts to restore and maintain sinus rhythm using antiarrhythmic drugs, cardioversion, or catheter ablation. Which strategy improves symptoms? Both strategies may improve symptoms, but rhythm control can enhance quality of life in symptomatic patients. What evidence supports early rhythm control? Trials show that early rhythm control reduces cardiovascular mortality, stroke, and heart failure hospitalization. What are the limitations of antiarrhythmic drugs? They have modest long-term efficacy and may cause adverse effects, including proarrhythmia or organ toxicity. What is catheter ablation for atrial fibrillation? Catheter ablation electrically isolates triggers when pulmonary veins are responsible for initiating atrial fibrillation. When is catheter ablation recommended? It is recommended when antiarrhythmic drugs fail or are not tolerated and increasingly considered as first-line therapy. How effective is catheter ablation? Randomized trials demonstrate superior maintenance of sinus rhythm compared with antiarrhythmic drugs. What are the risks of catheter ablation? Serious procedural complications occur in fewer than about 2% of the contemporary procedures. What is pulse field ablation? It's a newer technique using electrical fields to selectively ablate myocardial tissue while minimizing collateral damage. Why must comorbidities be addressed in atrial fibrillation? Comorbid conditions accelerate atrial remodeling and worsen outcomes if untreated. How does hypertension influence atrial fibrillation? High blood pressure promotes atrial enlargement and increases stroke risk, requiring strict blood pressure control. What's the relationship between atrial fibrillation and heart failure? Both conditions frequently coexist and can worsen each other through hemodynamic and structural changes. How does diabetes affect atrial fibrillation risk? Diabetes increases incidence of atrial fibrillation and raises risk of stroke and cardiovascular complications. Why is coronary artery disease relevant? Coexisting coronary disease complicates antithrombotic therapy and requires integrated cardiovascular prevention. How does obesity influence atrial fibrillation? Obesity promotes atrial enlargement, inflammation, and electrical remodeling that increases atrial fibrillation burden. Can weight loss improve atrial fibrillation outcomes? Sustained weight reduction and structural risk factor management significantly decrease atrial fibrillation recurrence. What role does physical activity play? Regular moderate exercise reduces atrial fibrillation risk and improves cardiovascular health. Does alcohol influence atrial fibrillation? Alcohol intake has a dose-dependent relationship with atrial fibrillation risk and recurrence. Why is smoking cessation important? Smoking contributes to atrial remodeling and thrombogenesis and increases stroke risk. What is integrated care in atrial fibrillation? Integrated care coordinates multidisciplinary management focused on patient-centered outcomes. What is the ABC pathway? Avoid stroke with anticoagulation, better symptom control, and C, cardiovascular risk factor management. Why is atrial fibrillation care? What is the AF care framework? Comorbidity management, avoid stroke, reduce symptoms, and evaluation of dynamic assessment. Why is patient engagement essential? Education and shared decision making improve adherence and long-term outcomes. Why must atrial fibrillation management be reassessed over time? Risk factors and treatment responses change, requiring periodic evaluation and therapy adjustment. This is in a nutshell the Lancet Seminar. Go ahead and read it. It's an outstanding article. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.